Good evening, everyone. We're going to wait just another minute or so before starting our webinar to give more of our registrants a chance to make their way into the Zoom link. So just another minute or so, and then we will begin. Well, good evening, everyone. My name is Zebulon Hyben, and I'm the Director of Chapel Music at Duke University Chapel. We're very pleased that you could join us for this webinar tonight, Singing Voice Health During COVID-19 and Beyond. On behalf of Duke Chapel and the Duke Voice Care Center, I'm really glad that you're able to join us. As we all know, this is a strange time to be in the world of music making, and particularly maybe of choral singing. The thing that we want to do most that gives us joy and life and community is the thing that we can't do. So instead we're relegated to Zoom and to enjoying musical content together rather than actually rehearsing and putting on concerts and leading worship services. And because of that, this seemed like a good time to partner with our colleagues at the Voice Care Center and offer a workshop, a clinic like this. But of course, we're also dealing with some vocal health issues brought about by the fact that we aren't regularly using our voices in healthy ways, in musical ways, which was another reason to address this topic together at this time. This is a two-part workshop, as you probably are aware. The second part will be in just a few weeks, and the two parts are related but not codependent. So if you know other folks who may like to join us for our second session, they are more than welcome and can register at the same link that you did. Many of you submitted questions for Dr. Wallstrom, and we've annotated those questions and grouped them. I will share those questions at the end, but you may find that a number of them are addressed by the contents of the lecture even before we ask them. So if you don't hear your question asked in exactly the words that you might expect, feel free to say something in the chat window, and Lauren Scarborough, who's our program coordinator, can make sure those questions get to me when we get to that question and answer portion of our hour together. And now, with no further announcements, I will introduce and turn things over to our guest. Dr. Audrey Wallstrom joined the Duke Voice Care Center as a clinical singing voice specialist in October of 2019. In addition to her clinical training and experience, Audrey has had an extensive career as a professional classical singer and singing teacher. She completed her Doctor of Musical Arts degree in voice at the University of Cincinnati's College Conservatory of Music with a cognate field in vocal pedagogy, and her Master of Arts in Speech Language Pathology at Miami University of Ohio. She's been an adjunct instructor and lecturer in voice at a number of universities and has been featured as leading mezzo-soprano in opera, concert, and recital across the United States. If you know how to use the little applause functions in your Zoom window, feel free to virtually applaud for Dr. Wallstrom. And Dr. Wallstrom, thank you so much for being with us.
Thank you so much for the introduction. And first, I'd like to start off by thanking Dr. Hyben and Lauren Scarborough for their help in preparing this partnership and helping us offer this content to you. As he said, I know many of you would be sharing this time together in person, making music. I know that's what all of us would rather be doing. And I so wish I could see all 228 of your faces right now. Unfortunately, we'll have to settle for connecting in this virtual space. But I'm just so happy to be here and have the chance to speak with you all. So let me pull up my presentation here for you, and we will get started. Okay, thanks for bearing with me there in this new Zoom landscape in which we are all living. So I am a clinical singing voice specialist at the Duke Voice Care Center, and we operate out of clinical locations in Raleigh, near Duke Raleigh Hospital, on the Duke main campus in Clinic 1F, and also in a newer building near the South Point Mall in South Durham. Our team is comprised of 2 laryngologists, and we also have a pediatric otolaryngologist who sees our youngest patients with voice problems, and a team of now 11 speech language pathologists, and 3 of us are clinical singing voice specialists who have advanced degrees in voice performance, as well as voice teaching experience and a background as professional singers. So an overview of how these 2 sessions are going to break down. So tonight we are going to talk about how voice disorders affect us, how the voice works, so some basic anatomy and physiology, what happens when things go wrong with the voice, how to prevent some of those problems, and should you get to the point where you are experiencing a problem, some information about how that will be evaluated and managed. Next time, we are going to talk about developing healthy vocal habits. So that concept of vocal pacing, which refers to both good voice use and avoiding injurious voice use, so both of those aspects. What you should know about age-related vocal changes and how that affects the voice, as well as tips to keep our voices in shape during this strange era of the pandemic. Things like how to deal with these constant Zoom calls and talking in a mask and dealing with social distancing and not having these regular healthy activities that we would normally be doing, like your rehearsals that you wish you were in right now. And we will also have a hands-on portion where we get started on some basic vocal exercises. So we are all here tonight because our voices are important to us. They are central to our personal identity, to our self-esteem, to our self-image, and for singers, the voice is our instrument. It may be part of our livelihood and part of our income. And even if it isn't, it's central to our quality of life, a source of artistic and creative expression, and can be a source of relaxation and fun, and a way to connect socially and in worship and in spiritual activities as well. So if you have a voice injury, all of these things can potentially be disrupted or jeopardized. I really encourage singers to think of themselves as vocal athletes. If we start to think of ourselves in that way, then we can better understand what is required to support the athletic activity of singing. So singing demands much more of your vocal mechanism than the average person's who is just dealt with your typical speaking demands. We're talking about much wider pitch range, sustaining sounds for much longer, and at much louder volumes. So if we think about how elite athletes in other types of sports take care of themselves, they're going to have a regular strengthening and conditioning regimen. They may, if they're professionals, have a team of trainers, physical therapists, and coaches who are helping them stay in shape. And they are very proactive about injury prevention. And we should think of ourselves in the same way. It's a real passion of mine as a voice clinician to start to eliminate a sense of stigma if you have a voice problem. For those of you who may have had formal vocal training, I think sometimes there is the implication that if you have a voice problem, it's because you did something bad. It's because you had faulty technique. And if you had just been singing properly, then you wouldn't have this problem. And I think it's really unfortunate because sometimes that might keep people from coming in to get some help and some useful information because they think they did something wrong. So I'm really passionate about having us think more of ourselves like athletes. We would never think less of a football player who had an injury. We understand that that's a very demanding activity, and that may put a person at increased risk for problems just by nature of the demands of the activity. So if we think about vocal athletes who might fall into this category, that could include singers, also actors, teachers, particularly music teachers who wear a lot of different vocal hats, choral conductors, professional speakers, call center operators, attorneys, and clergy as well. So all of these people really depend on the health of their voice for their professional success. And all of them are at increased risk for vocal injury just because of those demands. However, the good news is that the majority of voice problems can be prevented with good background knowledge and minimized. And there is help out there should you experience a problem with a voice team, including a voice physician and a voice therapist. So let's now talk a little bit about how your vocal instrument works. We can sing because we have a larynx, not a larynx, which is just a pet peeve of mine. So please don't say larynx. It is the larynx. And this is where it is located in the body. It's colloquially known as the voice box. So the larynx is made of a group of cartilages, muscles, and soft tissue that houses the vocal folds. The larynx is also the upper opening into the windpipe or the trachea, which is the passageway to the lungs. It is suspended via a network of muscle attachments, which allow it to rock, stretch, and move up and down in order to swallow, and also to make a variety of vocal sounds. Within the larynx, the vocal cords close to protect the airway or make sound, and open when we breathe. So if we think of the voice as an instrument, we can imagine three subsystems which have to work together in order to make it work. So the power supply will energize the sound. That is our power source. We need a source of vibration, and we also need a resonator to shape and filter that sound. So in terms of what is what, the power source of the voice is airflow. And the airflow is generated by muscles acting on the lungs and attached to the rib cage. We are going to go into a lot more detail about breathing mechanics in the next session because that will tie into some of the exercises that we are going to do. So stay tuned for sort of functionally how we can optimize this aspect of voice production. We will get into that next time. So our source of vibration is, of course, the vocal cords. So they vibrate and they displace the air, which creates sound waves. So the vocal cords are going to come together and air pressure builds up below them until they blow apart. Now the vocal cords vibrate hundreds of times per second when we are either speaking or singing. So if you have the pitch A 440 in your mind, that concert A, that means that your vocal cords are vibrating 440 cycles per second. So a terminology question here. True or false, vocal folds and vocal cords are the same thing? This is true. They are the same thing. Now, technically, vocal folds is a bit more precise in terms of describing the structure, but vocal cords is not incorrect. And you will see that used interchangeably both in the medical community and just in other discussions of voice. And either one is fine. Some people are sticklers about that, but I'll probably use them interchangeably because they really mean the same thing. So you can call them vocal folds, you can call them vocal cords, but please do not call them vocal cords with an H. Vocal cords with an H are what you make with your choral conductors when you are all singing beautiful harmony together. So that is the one thing that is not correct. So where are the vocal cords or folds? Here you see where they are located in the throat. And this view is as if you were to slice through and have a perspective on an endoscopic exam. So if you can see my mouse here, the vocal cords are going to be right here in the front. So when you breathe, air is going to go this way. And if you were to swallow food, the food would go this way. And that is what you would be seeing through the camera if you were looking at the endoscope in terms of what the examiner would be seeing. So how big are the vocal folds? As big as your nose, as big as your pinky, as big as your thumbnail, or as big as your foot? Now, obviously, some of these are out of the question, but you may be surprised to know that the vocal cords are small. They are about the size of your thumbnail, so something quite small can really make a lot of sound. Now, how does that happen? Well, the vocal folds need some help to sound like a voice, and that brings us to our third subsystem, and that is the resonator. And for us, as vocalists, that is the vocal tract, and that is everything between the vocal folds and the lips. So the vocal tract serves to filter and amplify the sound produced by the vibration of the vocal folds. And it can change shape through the movements of the tongue, the lips, the jaw, the soft palate, and the other muscles of the throat. So this is how we shape vocal sounds into words that are intelligible and make different types of speech sounds. So all sounds generated by vocal fold vibration are going to pass through the vocal tract before being heard, except in this really interesting simulation in which the raw vocal sound, which is going to sound like a harsh buzzing sound in this video I will play for you in a moment, is isolated and then paired with different filters which have been modeled to recreate various vocal tract shapes. So you'll see on the screen whether it is a simulated male larynx or a simulated female larynx and the different vowels that they are producing. And as they take these filters on and off, you will hear it go from a harsh buzzing sound to something that sounds pretty convincing, like a human voice. So let's listen to this. And it takes a moment for the sound to load up, but I'm hoping you can hear what I'm hearing. Oops, looks like we went to the next slide. Let's go back and try that again. So you can see what a dramatic effect the resonator shape has on the vocal sound that is produced. So now let's go ahead and take a look at the vocal folds in action. So I'm going to show you a brief clip of the exam that we do in the voice clinic, which is called video stroboscopy. Now remember that the vocal cords vibrate at hundreds of cycles per second, so we need a very specialized machine in order to evaluate their vibration. So we're able to track with a microphone how fast they are vibrating and then reconstruct simulated slow motion to actually watch the vocal cords vibrate. So let's take a look at these vocal cords. Okay, so you can see how the vocal cords move in order to change pitch. So hopefully you were really spotting that carefully, because here's another question for you. So how do we change pitch? Do the vocal cords or folds get longer as the pitch gets higher? Do the vocal folds get shorter as the pitch gets higher? Or do the vocal folds stay the same and we change the pitch with our mouths? Well, if you were watching carefully, and you could hear the sound on the video, hopefully you noticed that A, the vocal folds get longer as the pitch gets higher. And if you think about other types of stringed instruments, it's going to be the same principle. If you're tuning your guitar or your violin, if you want the pitch to be higher, you turn that peg so the string gets stretched more taut. It's usually the thinner string, as opposed to the lower strings, which are going to have more slack and be thicker. And so here we can see some still images of that happening in the vocal cords. This picture on the left, this is a lower pitch. This is the same person's larynx. And here we see a higher pitch on the right. Now we'll talk about the structure of the vocal folds. We are able to do what we do with our voices because of the unique structure of the vocal cords and their different layers. So the deepest layer is actually muscle. And you see it here in the sort of reddish part of the picture. Then there is a ligament layer, which serves as a transition and attaches the muscle to the outer layers, which are comprised of the superficial lamina propria and the epithelium. Those are really important because of their jello-like properties. So there's this gelatinous layer of tissue on the outside of the vocal folds that needs to be really flexible and pliable to respond well to changes in airflow so it can vibrate easily. When we run into problems is when something happens to harden that jello layer. Friction is something that can do that. So with changes to that layer over time, with repeated and excessive friction, you can get a callus layer that forms, and that changes the way the vocal cords vibrate, and you're going to start to experience some changes to vocal function in that case. So now we're going to talk about what can happen when something goes wrong with the voice. Here's some symptoms you might notice. You might notice that your voice is hoarse, that you get tired when you sing or when you speak. Maybe you've lost your upper range, or you had an illness and your voice just never really bounced back. Or you went for a note and something strange happened. Or you have voice breaks when you sing that you didn't used to have. Or you just have a longer recovery time after a rehearsal or after a long day at work of speaking. So there are a lot of factors that contribute to a voice problem. So often people come into the voice clinic and they're looking for the one thing that caused their voice problem. And in my experience, it is very rarely the case that there is one factor that you can put your finger on that actually caused the voice problem. It's usually a story more like well, my voice started changing in December. Okay, well, what was going on in December? Well, we had a holiday concert, so we had lots of extra rehearsals. Oh, and there were a lot of social events that I was talking at in a pretty loud voice during that time. Oh, and also I had a cold the week before, and I wasn't quite back to normal before I went into all those rehearsals. Oh, and now that I think about it, I wasn't sleeping well, and I was eating a lot of rich foods, and so on. So, in that little hypothetical situation I described, we've actually touched on each of these factors, and it is most often the case that there is an imbalance in multiple areas that is contributing to the problem. So let's talk about the different types of voice disorders and the broad categories. So frequently we see patients who have problems with muscle tension in the voice. We see vocal problems that arise from trauma to the vocal cord, so voice use related. We also see problems that are neurological in origin, such as a few of these disorders you see listed there. And also infection can affect the voice. Now, the top half of this pie chart, if you are someone who is a vocal athlete, you may be more likely to experience these two categories on the top of the pie chart, but not at increased risk of those on the bottom of the pie chart. They will affect your voice, but they're not related to voice use. So let's look a little bit at some of the problems that can arise from vocal fold trauma. Now, for those of you who don't like looking at pictures of anatomy and throats, and for the squeamish people, I'm going to take you through some slides that show some vocal injuries. So just fair warning on that. So these traumatic vocal fold lesions are a response to injury, and they arise in that outer jello layer that we discussed earlier. They can come from inefficient coordination of the voice and from overuse of the voice. And because it stiffens that jello layer, it is going to affect vocal fold vibration and affect how well the vocal cords are able to close. So let's look at a few specific types. So here we see vocal fold nodules. So they are a callus-like hardening of the outer layers of the vocal folds, and they are going to appear where the vocal cords strike together with the greatest force. So in this situation, when the vocal cords close, it's the bumps that actually hit first, and then you have air leaking through the vocal cords when you're trying to sustain a sound, and the sound may be breathy, you may have problems holding a note very long, the pitch of your voice may get lower. So another problem you may experience is a vocal fold cyst. This is not necessarily related to vocal fold or to excessive voice use. This can come from a clogged gland in the vocal cords, so there's a fluid buildup. And then the other side of the vocal cord can be injured because this thing that's sticking out is banging together on the other side and irritating it. You can also have a vocal fold polyp, and this is a particularly bad one. Most of the polyps we see are not quite so large and scary looking. But polyps are different from nodules because they can occur on either one or both of the vocal cords, and they tend to be more vascularized, meaning there's a blood supply there, and they can be reddish in color like this one. And in the case of a really chronic, ongoing voice problem, the outer layer of the vocal cords can be so damaged that you end up with permanent scar tissue on the vocal cords. Another potential problem involves the blood vessels of the vocal cords. So here we see what's called a vocal fold varix. So that is sort of like a mass of capillaries that looks like a small blood blister that has hardened over time. And if you actually have a capillary burst in your vocal cords, you can end up with this, which is a vocal fold hemorrhage. And this is the case where resting the voice is extremely important. A person with this type of an injury would experience a sudden change in vocal quality, maybe after yelling or singing really loud, and it would be really a sudden onset of very obvious hoarseness. If that ever happens to you, please rest your voice and come and get it checked out as soon as possible, because we want to avoid any kind of permanent scarring in that situation. This situation represents what's called muscle tension dysphonia. That is a technical way of saying that you have strained patterns of muscle activity when you use your voice. If you remember the other pictures of the vocal cords, usually you could see the whole length of the vocal cords from front to back when we're looking down, but we can't see these vocal cords, and it's because the muscles above them are squeezing really hard. A person with this problem may find that they have trouble getting to certain parts of their vocal range, that their voice gets tired very quickly, but it may kind of come and go. So maybe their voice is clear in some situations and they really struggle in others. And that's one of the most common things that we see in the voice clinic. So when you have a voice problem, there are a few different categories of things we might do in order to manage it. Behavioral, meaning we help you identify what you are doing that could be contributing to the problem and help you make changes there. Medical, meaning do you have a need for some sort of medication? So your physician would be advising you on that. And in certain cases, surgery on your vocal folds. I will say that the majority of cases that I see that come in, it's mostly going to be the behavioral changes that make the biggest difference. That isn't to say that some people don't need allergy medication or other types of medicines, but most cases that we see are not going to require vocal cord surgery, which is good news. And here, I should have warned the squeamish among you about this one. So here we have some still images of a vocal fold microsurgery. So you can see this lesion here, which is removed very skillfully. And then what we're left with is a nice smooth vocal cord edge. Now, of course, there is a little bit of bleeding because this needs to heal, but this person would be told to rest the voice for at least a week with absolutely no talking, and would probably have a dramatically improved vocal quality after this surgery. So now let's talk about how to avoid a voice injury and take care of your voice. So some of the things we do for that purpose are just taking care of our bodies in general. The voice is a holistic system that is part of the rest of our body and is all tied up in our general wellness. So the other piece of this is using the voice well. And what do we mean by these vocal hygiene suggestions? Well, the first one is, of course, staying well hydrated, so drinking plenty of water. The better hydrated you are, the more efficiently the vocal folds vibrate. I use the analogy a lot of driving a car with no oil in it. We all know not to do that. The engine is going to overheat and could cause some permanent damage. Think of your vocal folds in the same way. So if they are well hydrated, it cuts down on that friction and you're going to be less likely to have an injury. General recommendation is about 64 ounces of water per day. Other things that you can do will negatively affect hydration: drinking too much caffeine or alcohol, being in a dry environment, and also certain medications. So what we see in this picture here is this thick, sticky mucus. And if I looked at this exam, I would know that this person was not very well hydrated and should increase their water intake. Another aspect of vocal hygiene is managing acid reflux. So stomach acid can come up from the stomach, and splash out of the esophagus, even in small amounts, to irritate the vocal folds. And when that does happen, stomach acid is very corrosive. So that delicate vocal fold tissue can be irritated and you can have some burning or swelling. And if you have an existing vocal fold injury, that can slow down the healing process for that. However, when I said earlier that a lot of times people are looking for the one reason why they have a voice problem, this is a reason that many people are very eager to use to explain their voice problem. And while reflux can certainly be a factor in voice problems, it, in my experience, is pretty rarely the sole cause of a voice problem, except in pretty extreme cases. So I would encourage you to look beyond that as a possibility for a voice problem. And in fact, one of our physicians, Dr. Cohen, has published an article dealing with the possible overdiagnosis of reflux as the cause of hoarseness. So there may be more to the picture in that situation. Things that cause reflux are pretty much all of our favorite things in life. I know I'm a pretty big fan of most of the things on this list. So that includes spicy foods, food and drinks that are acidic like citrus and tomatoes, alcohol, fried and fatty foods, caffeine, carbonation, mint, and chocolate. Does this mean that you should never eat or drink any of these things if you want to have a healthy voice? Not necessarily. It's like anything else where moderation is key. So the advice here is to follow your doctor's recommendations if you need medication. Avoid things that put pressure on the stomach after you've eaten, like singing or exercise. You don't want to lie down with a full stomach for 3 or 4 hours. You can raise the head of your bed by 6 inches to help with gravity, so reflux doesn't come up when you change positions. And if you are overweight, extra weight can also cause more pressure on that valve that keeps the stomach contents down where they belong. Also, drinking enough water can help with reflux as well. I probably don't need to tell you that smoking and singing don't mix. It can cause vocal cord irritation and coughing, and we know that it is a risk factor for laryngeal cancer. And secondhand smoke is also going to count as a risk factor for these things as well. In general, we want to maximize our resistance to illness. I know that is on our minds in a much more specific way lately than it usually would be. And we are all trying to maximize our resistance to illness all the time these days. But in general, you know, regular exercise, eating well and sleeping well, and just keeping yourself healthy in general is also going to have a positive impact on your voice, as it is part of a whole body system. So you want to avoid coughing when you can. If you're actively sick and you have to cough in order to productively clear mucus from your lungs, that's one situation. But when you can avoid a dry, itchy cough or a harsh throat clearing, you want to do that because that's extra trauma on the vocal cords. If you are sick, you have a cold or laryngitis, it's best to rest your voice. So try to scale back where you can in that situation. Some medications can also affect the voice. Some of them have drying effects. A lot of over-the-counter cold and allergy medications fall into that category. Here's a resource for you from the National Center for Voice and Speech. They have a database of different medications, and you can look it up by the name to see if there are any known effects on voice for that medication. I will qualify that statement by saying you should always talk to your doctor before you change any of your medications, because only your physician knows the full picture of what you need and what that balance needs to be for you. Lozenges. So when a lot of us have throat irritation, we reach for a cough drop or a lozenge to soothe that. Unfortunately, a lot of the most popular brands actually are harmful. Menthol and eucalyptus that are in the regular halls, for example, are very drying. And ultimately, that is going to perpetuate that problem of throat irritation. So there are lozenges that are not drying. So here are some of the brands listed in front of you. And you want to look for lozenges that are glycerin, slippery elm, or pectin based as their active ingredients. So in terms of using your voice well, the vocal folds, the edges of the vocal folds come into contact with every cycle of vibration. If that contact is easy and gentle, you're going to have a more resilient voice. If it is harsh and forceful, you may end up with a vocal fold injury. So here are some behaviors that are going to put you at risk for vocal injury. So throat clearing and coughing, yelling and screaming, talking excessively loud or in noisy situations, and also singing without adequate technique or training, where you're maybe trying to sing in a range that isn't comfortably developed, or you're trying to sing in a style of music that you haven't practiced and don't have appropriate technique for. In terms of using your speaking voice well, you want to think about posture and optimal breath support and a frontal placement of the tone. I am going to get into this as well a lot more the next session, so keep that in mind. But just as a quick demonstration of what I mean by a frontal placement of the tone, the voice I'm using now, hopefully nice and resonant. A voice that is not so resonant and doesn't have much of a frontal placement might sound a little bit more like this, where it's very back and kind of focused in the throat. That type of a voice is going to be very tiring, and that will involve muscle tension and strain, which we want to minimize. Now, a good speaking voice does not necessarily mean talk at a higher pitch. So talking like this, which is not natural at all for my voice, is going to cause a different set of problems. So that is a vocal myth, which we can just dispel right now. You should talk at a pitch range which feels natural for you, but with good breath support and with a resonance that is hopefully efficient and not stuck in your throat with that gravelly quality. More on that later. So in terms of conserving your voice, it's that concept of putting the mask on yourself first. And unfortunately, anything having to do with masks has a sadly different kind of a relevance to us these days. But what we mean by this is to make yourself and your vocal health a priority. Sometimes that might mean saying, you know what, I need to rest my voice after work today. I'm going to talk to my family and see if they can get on board with letting me have some voice rest and some quiet time. And understanding that doesn't mean I don't want to talk to them, but I just need that time for myself right now. I want to let you know that it's not normal to be hoarse after voice use. So if after every rehearsal or every day after work, you notice that your voice is hoarse and tired, we want to know why. It is a sign of a voice injury. It is a signal that your body is telling you, and pushing through that can possibly result in some permanent damage. So we really encourage you to come and get that checked out. You are your instruments. And as I said before, you, as a vocal athlete, have greater voice demands than people who do not use their voices for singing. So how do you know if you have a voice injury? Here are some specific symptoms you might notice. A change in voice quality that lasts for more than 2 weeks. Maybe a hoarse, raspy, breathy, or gravelly quality. Loss of vocal loudness or vocal range. You might notice new vocal breaks when you didn't have them before. Or a change in the amount of effort it takes to speak or sing. Or your stamina is down. It wears out much more quickly than it normally would. What should you do if you think you have a voice injury or any of these symptoms? Well, we would encourage you to come and see us and see a voice care team, which involves a laryngologist, which is a physician with specialized training in voice problems, and a speech pathologist who, if you are a singer, is also a clinical singing voice specialist. So we can really look at all of these symptoms and your history and put the picture together. So you owe it to yourself to get this care, to get to the bottom of what's going on. When you come into the voice clinic, we will do a comprehensive voice evaluation, which involves a case history, finding out what was going on at the time of the problem. We will do an exam of your larynx, like I showed you earlier, so we can really see what's going on with the vocal cords while they are in action. And then based on what we find, we'll make a personalized treatment plan to maximize your healing and to keep you from running into the same problems again. And for some, speaking and singing voice therapy might be recommended, so specific exercises that target your specific problem, including figuring out where you may be struggling with those vocal hygiene aspects and helping you improve your vocal pacing. So we may also consider getting a baseline voice evaluation when you're feeling healthy. That way, if you ever experience a voice problem, we know what your baseline is and how things look when you're working normally and feeling like yourself. So it's very helpful as a basis for comparison. So in summary, you want to stay well hydrated. If you have reflux, follow those precautions and take medication as directed by your physician. Don't smoke. Be careful of how you're using your speaking voice. Warm up your voice and know your limits. We will talk about some warm-ups and how to structure a practice session in our next meeting in October. Practice excellent vocal pacing, another big point of discussion for next time that we'll expand on then. And if you think you have a voice problem, consult voice care specialists. That's really the only way to know what is causing your problem. And if necessary, follow the recommendations for voice rehabilitation. So here is the information to contact our team if any of these things sound like they may be relevant for you. And that actually brings me to the end of my presentation. I did prepare some answers ahead of time to some of the questions that I received from you. Thank you so much for those. So I thought I might start with those, and then we can add on any that may have come up as I was speaking a little bit earlier. So let me dive into this first one here about thyroid dysfunction. So the question is, can thyroid dysfunction cause vocal strain and fatigue? And yes, it can. And there are two mechanisms by which this can affect the voice. So one is a problem with hormone levels. So if your thyroid is not managing the hormone levels properly, either too little or too much hormone being secreted. In the case of underactive thyroid, the vocal cords can thicken and make the pitch lower. In the case of overactive thyroid, the voice can be tremulous. However, now I am not an endocrinologist, and I will say that as a disclaimer. However, the other symptoms of thyroid dysfunction are probably going to be pretty obvious at that point, and managing the thyroid levels is going to help with that. So that's one way that it can cause problems, is if your hormone levels are off. The other potential issue is if there is overgrowth of the thyroid or very large nodules, which actually have a compression effect and actually push on the structures involved in the voice. So that can also happen. Whoops. The second question, I'm having a great deal of phlegm on my vocal cords. How does one A, help prevent it, and B, remove it? I'm so glad you asked this question, whoever you are, because it gives me a chance to talk about one of my favorite things, which is telling people not to clear your throat, because it doesn't do any good. It's really like scratching a bug bite, and we know not to do that, right? We feel the itch, but we know if we scratch it, that it is going to keep that irritation going and continue that cycle. So I tell you, I hear this all the time. I have all this phlegm in my throat and I have to clear my throat. And then we look in your throat, there's really not a whole lot of mucus or excessive mucus down there. What tends to happen is that people develop a hypersensitivity to the presence of any mucus in their throat because their voice is strained. So it's that the voice is already irritated, and then it's that irritation that your brain is interpreting as mucus that you have to clear. So how to prevent it? Well, if you have vocal strain, we want to work on that. Also, being well hydrated is going to make that mucus nice and thin so it clears away easily. And how to remove it? Just go ahead and swallow. If you have to do something, try not to do a harsh throat clear, but something more like a sharp puff of, or little puff of air, and nothing that's that really harshly rubs those vocal folds together and makes friction. And then another question was, do different types of singing have different degrees of wear on the voice? I was really happy to see this question as well, because I think there is an impression among classically trained singers that other styles of singing are bad and scary and dangerous. And this is not necessarily true. It is true that in belting or certain types of, pop style singing, the vocal cords are spending more time in a closed position as they're vibrating, that the impact is a little bit higher, and that more of the body of the vocal cords is touching. However, if you have good technique and are well conditioned, that does not necessarily predispose you to a voice problem. Now, there are certain stylistic effects that are going to be a little bit more vocally expensive, things like growling and rock music and that type of thing. And so I would encourage people to think of that sort of like spice in a meal. You want to use that judiciously in order to have some flavor, but you're not going to make your whole meal out of that. So I guess the answer is yes, there are certain things that are more taxing on the voice, but different styles of singing, or singing in a particular style, if you have a solid technique and are in good vocal shape, does not necessarily mean you're going to have a vocal problem. I'm not going to answer all of these questions. I put these all up here because these questions all described specific symptoms, and hopefully you know from my presentation that the best thing to do is to get a voice evaluation so we can determine the causes and solutions that are specific to you, because that's really the only way to know the answer to these types of questions. And then I just wanted to put these up here to show you that I got your questions and that I am planning to answer them in our next session, because as I said, I am planning to spend a good amount of time talking about vocal pacing. So how to optimize your vocal load if you're having to talk a lot, and also talking about how to structure a warm-up, which I know a lot of you were pretty interested in. And also, we'll spend a fair amount of time talking about age-related changes to the singing voice, which was another hot topic in the questions that I received. So we are going to cover that next time. So if there were any other questions that came up, I'm happy to.
There were just a couple that came up in the chat that I think pertain more to today than
sure,
Dr. Wallstrom.
Yeah.
If you don't use your voice often enough, if you don't do a lot of talking or speaking for a period of time, is there any danger that that the jello layer will thicken or become less flexible?
Good question. The first part of the question seems to be wondering if not keeping up with your voice can change the way it functions, and that part is true. But it is not so much the surface of the vocal cords that are impacted by that. It's more the muscle strength and the coordination. So there is a use it or lose it aspect to the voice, just like any other kind of physical, athletic, muscular activity. And I think there are really two pieces to that, both the strength, like if you were a runner and you stopped running for a couple of months and then you tried to go back and run as far and as fast as you were a couple of months ago, that's not going to go so well. So it's really quite similar in that sense. And also it's the rehearsal part of it, getting that coordination. And when you're out of practice, in terms of the motor planning, it's that piece of it too. So it's not so much that you're damaging the structure of your vocal cords by not using it. It's more keeping up strength and coordination.
Being out of shape, so to speak.
Exactly. Mm-hmm.
Related to your comments about different styles of singing and the
Mm-hmm.
preconceived notions that certain ways
Yes.
are naturally unhealthy.
Mm-hmm.
We had a couple questions about the use of the voice in different parts of the vocal range. So
Mm-hmm.
singing at extreme low parts of your own
Mm.
instrument, or singing very high for any length of time, more or less tiring than singing in sort of your tessitura.
Sure. I think that's a great question. So I think it really depends on where your voice feels comfortable. And you just used the word tessitura, which I think is the key. And what that means is, where does the voice kind of hang out? Not, is there one high note that you pop up to and then kind of go back to where your voice tends to like to live? Or does it really sit in a higher range where it just keeps hammering away in this range, which is really kind of in the extreme of where you are? So I would say that listen to the signals that your body is sending you. If you are in a choir rehearsal and you're doing a piece like, I don't know, Beethoven's Ninth or something that just keeps on going and going and going, and you feel
Right. Yes.
right, and you feel tired and you feel strained and your voice is hoarse afterwards, that should answer your question, that is not where your voice wants to be. However, if you are someone who is a vocal chameleon and you feel like you can jump around and sing different parts and you feel fine and you're able to navigate that, then it's not necessarily a problem. But you'll know if it's uncomfortable by how your voice feels. So just listen to those signals that your body is sending you, is what I would say.
Speaking of discomfort, someone asked if there is a healthy way to cough sick. So if you're sick,
Yes.
partly involuntary or largely involuntary, is there a way to do it that's
Yes.
less detrimental?
That is a fantastic question. And yes, sometimes we do have to cough. We're sick and we can't avoid it. So what do we do in order to modify that cough? Well, we can create a smaller mouth opening, which actually creates a little bit of back pressure when you cough, and that makes a little cushion of air that helps blunt the force of the vocal cords banging together. So you can cough with pursed lips like this. You can feel that is less harsh than like a big hacking cough, which really bangs the vocal cords together with a lot of force. So, especially if you're on the back end of a cold and the coughing is just resolving irritation, that pursed lip cough is going to be better. Better still would be trying to take a sip of water so you can just get rid of that tickle and don't cough at all. Or you can use a breathing technique where you actually try and relax your abdomen, breathe in through your nose, and then breathe out through pursed lips. It's a similar concept where it makes that back pressure and it helps to release this spasm that wants to occur when we're coughing. So that's a great question.
Excellent. The last question that I'll share, and for those of you who typed questions into the chat window or the question and answer function that we didn't address, we have taken screenshots of those, so we've got them and we'll add them to our roster of questions for next week.
Perfect.
But just sort of to summarize, I think it's been pretty clear throughout your presentation what the answer to this is, but because anytime I've been with folks and the issue of vocal health has come up, and someone with your training and experience has spoken about some of the issues and the ailments that may plague the voice, there's always this anxiety about
Yes.
recovery. And what I am hearing from the presentation overall is that with appropriate care and attention from medical professionals and rest and changes to behavior, there are very few vocal health ailments that we can't make progress from and recover from if we take those steps and see the people who are the experts. Is that accurate? We don't need to go to bed frightened about permanent.
Yes. Thank you so much for saying that. And I think that is a great way to wrap things up. That is absolutely accurate. I have hardly ever seen someone where I said, there's really not a lot we can do here. And certainly if you're someone who is still singing, then there is so much that we can build on with that. I showed you some of the ugliest lesions just, for illustration. That is not what we see most of the time when people come in. Most of the time what we see is that people kind of got into a pattern of strain and fatigue and are just having a little bit of trouble rebalancing those factors and getting out of it. But we can really make progress and move people forward with some targeted exercises in most cases. So I would really encourage you, even if you feel like, oh, I've gotten older and my voice just isn't what it used to be, there is still a lot that can be done in order to improve on that. So we'll touch on some of those proactive, positive, constructive activities next time. Unfortunately, there just wasn't time to get into everything in this first session, but I do plan to be really focused on, like I said, proactive activities as a big part of the next session. So please don't be apprehensive if you have any of those symptoms. What I want you to know is that we can most likely help you with that if that's something that you're experiencing. So thank you for asking that and phrasing it that way. I appreciate that.
Wonderful. Well, thank you so much for this time. This has been really helpful and useful and informative. And I think anyone who was here tonight will hopefully want to come back for the second session on the 14th. And as I said before, if you know others who might like to join us, feel free to invite them.
Absolutely.
More the merrier. And we'll just conclude by thanking you, Dr. Wallstrom, for this time and for all the information you shared. Bravo and thanks.
Thank you so much for joining us. And I hope to see you all on October the 14th to continue.
Splendid. Have a good night, everyone.
All right. Good night.